What's going on, everyone? Happy Monday to everyone. Welcome back to my channel. It is now time for the Monday edition of the Pandemic Update for Monday, August 7th, 2023. Starting off with India today. India has added another 54 new cases. Their active case count is at 1,574, and their death toll did stand at 531,918 deaths. So their cases, while we have been seeing a few days that bounce up higher, today is not one of them. So that is good to see. Now we have to report on this. There is visitor restrictions now in place at Sligo Hospital following a COVID outbreak. And you're probably going, Sligo Hospital, where is that? Well, I did some research, and it turns out Sligo Hospital is in Ireland, and they are having an outbreak in a portion of the hospital. We'll be talking a little bit more about Ireland in a little bit when we get to the international update at the end of this video, because Ireland cases, they're not trending too well at this time. Alright, swine flu. We got some swine flu news today. Second swine flu case is now confirmed in Michigan. So apparently there's a swine flu outbreak that's now starting to go underway. It's the second case that has now been linked to pigs in Michigan. I actually just saw this on the news a little bit ago, and I did some research, and sure enough, here you go. There is a swine flu that is ongoing. It looks like it's being coming from pigs that attended the Oakland County Fair last month. So we'll have to see if any more cases come up out of this, and we'll have to see what happens as this continues. Now, moving on to this, we have more news on a tick-borne illness. It seems to me as if we are talking about ticks a lot lately, and here we are yet again. Bethlehem, Pennsylvania, my state of Pennsylvania. It says, if you get sick after eating beef, lamb, pork, or dairy, doctors say you could have something called alpha-gal syndrome. Now, they may say in this article that it is rare, and perhaps it is, but I think there's a big problem with that. While it may be rare because there's not a lot of detected cases, how many people are actually going to go out and get tested to say, hey, wait a second, maybe this is what I have? A lot of people don't put two and two together, and plus, here's another reason why it may not be rare much longer. Ticks are just I've said this time and time again as of lately, and, as we go in, as we have these videos together through the rest of this year, and in the years to come, ticks are going to be something we're going to be talking about more and more, because the population of ticks, thanks to climate change, or thanks to a warming climate, whatever you want to call it, ticks are just rapidly multiplying. The climate is right for them to do so, and because of that, the number of ticks that carry illness and diseases is going up, and here you go. Alpha-gal syndrome, it's on the increase now, and cases of it are being found in the Lehigh Valley. Lehigh Valley is Lehigh County, Northampton County, Upper Bucks County. The Poconos is southern Monroe County. So there's a lot of counties in Pennsylvania. Berks County, that, this is a concern. And it's not just in Pennsylvania. You should be concerned about this anywhere across the United States, because this is going to spread. The tick population in the United States is increasing. Alrighty, continuing on now to this. Some COVID news. BioNTech reduces drug development spend as COVID vaccine sales plunge. If you've opted saying, I'm not going to get a booster, yeah, there's a lot of people that are saying that. And with the sales dropping, guess what? They're not going to be making as many dosages, because what ends up happening is doses after a while go bad. And that's happened a lot. And they've seen their sales go down. So they're not going to invest money into something that could end up becoming a waste. It's actually sad to see, because these shots, they're safe, they're effective as far as we know. They don't fully, I'll admit to this, they don't fully prevent infection. They don't fully prevent long COVID, but it's better than a do-nothing. And when you combine that with masking, it does work quite well, and it does drop the severity of your initial case. Again, it's worth repeating. Long COVID doesn't always, it can still happen, and we know the many different ways and roads that can go down, so that itself is still a problem. But again, when less people take the vaccine, guess what happens? there ends up being leftover dosage, and when they have doses that aren't left, they're going to say, well, why are we manufacturing X amount and then having waste? That's money being spent that's just going down the drain, and, well, as you can see here, that's what's happening. And, of course, as you know, Pfizer and BioNTech, they're billion-dollar companies, so why they're worried about that, profit over our safety? They should be putting more campaigns out there trying to get more people to take these boosters, because right now there isn't much immunity to be had, and that's giving COVID the upper hand to really let this next wave rip. All right, the UK, speaking of letting COVID rip, it's ripping in the UK right now, but we honestly don't know to what degree, because the UK is saying almost flying blind on COVID this autumn, experts say. As cases rise, scientists say the country is mostly in the dark about how infections could play out in the coming months. And you know what? That's not just true in the UK. I think that's true in most countries. Yes, we have wastewater here in the United States, but you see the various different forms of data I share with you on the channel. Earlier today, we did the Walgreens update. If you didn't see that, it's the video just before this one. And you can see often in some states, Walgreens data can show something completely different from wastewater data. Hospitalizations could show different signals from case data. I mean, it's mixed signals. And the biggest problem is there are not enough people getting tested, and not enough of these at-home tests get shared. We just don't have enough case data. Having more case data, I mean, did we ever have an accurate count from day one? No, we did not have an accurate count from day one. But what I'm leading at here is, if we did have an accurate count, say anyone who was sick, anyone who had contact, remember contact tracers? They would go out and contact trace and try and find any possible cases. Well, if every T was crossed and I was dotted, yes, then we would have an accurate feel of just how big this wave is. And unfortunately, the UK doesn't have an accurate count. Neither does the United States. Alrighty, moving on to this. This one kind of gets to me. School prepares for back-to-school illness. Yes, you have to start thinking about COVID going back to school, but there are some things down here that are just totally ludicrous. Rather than me trying to find them, they're basically saying kids need to wash their hands. They need to cover their mouth. Oh, that's not how we cover our mouth. You need to go like this. They need to cover their mouth. I mean, come on. Enough with the old school techniques that just aren't going to work for COVID. If you want kids to cover their mouth, here's one way of doing it. This is a mask. Masks are safe. They're effective. I think I repeat that message many times throughout the week. That's the second time we said that message in this video. And there's also another way of keeping kids safe in school. And we're going to show you that right now. Knowing the symptoms of COVID. From time to time, we go through the symptoms of COVID or long COVID. In this case, we have to go through the symptoms of COVID. And we're just going to read the basic ones. There's hundreds of different symptoms, but here are the basic ones. Fever or chills. Does your child have that? Guess what? They should stay home from school if possible. Cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. That's just the basic symptoms. There's many others that could happen, such as dizziness. There's a whole bunch of different things that could happen, but you know what you should do? This is just my advice. I don't have kids, but if I did, I would do this. I would go through a checklist each day. Does my child have any of these symptoms? And you know what? If my child does have, or if your child does have any of these symptoms, notify your school and tell them. Also, if possible, take a COVID test. It's not that hard to do. I get it. They may be expensive now. Take a COVID test. If they test positive, your child needs to stay home from school, and you need to find some way to, where they can be watched at home. I get it. Not all cases can someone keep their child home from school. Some people cannot afford to take a day off of work. I fully get it. It's tough out there. But if you have the means and you have a way of keeping your child home from school when he's presenting any of these symptoms, by all means doing so. Because, you know what? If you send your little son, Johnny, to school, then he goes and sees his friend Timmy, and he coughs all over Timmy, then Timmy takes it home to his parents. His parents get sick, and let's just say Timmy goes and visits Grandpa Joe. And he goes to see Grandpa Joe, and, well, suddenly Grandpa Joe's infected, and Grandpa Joe may be high risk. And suddenly Grandpa Joe ends up in the hospital. All because you sent your kid to school, which infected another family. That's how it works. One infects another, and it just keeps going on and on and on, especially in times of a new variant that continuously increases. Alrighty, moving on from that message for today. Let's take a look at the latest air quality data. And air quality, it's kind of a mixed picture across the United States. You can see in the east, there is some poor air quality. There's also some severe thunderstorms ongoing in the east. Then you have some really bad air quality in the Dakotas. In between, like Detroit, you're actually getting some good air quality today. But we'll watch as this wildfire smoke from the Dakotas does make its way southeast. On the west coast, California is generally poor. Not terrible, but it is getting a little bit worse. And Washington and Idaho, there's some concerns for you as well, with exceptions to the coastal areas up there. If you want to learn more about how weather affects our climate, I do have a channel that does just that. And that right here is at Climate Data Report. Remember, climate can affect our health too. And we've already done 2 videos today talking about a big severe weather threat that is ongoing in the mid-Atlantic and the east coast today. Big time severe thunderstorms. There's already been a few tornado warnings, so check that channel down below, which will be in the description for more on that. National positivity today from Walgreens. We did our video just before this one. Then the current week's positivity did rise by 3.4% to 44.7%. All right, now let's quickly take a look at a few of those wastewater sites that show other things besides COVID. Starting off with Harrisburg, Pennsylvania today. Going to move myself to the left. Harrisburg, the overall trajectory has been much higher for COVID. It did drop on the most recent update on August 1st. Influenza not detected. RSV not detected. HMPV not detected. Mpox not an issue. Norovirus, it's there, it's at low levels, and it has dropped ever so slightly since June. Let's do one more wastewater site today, because we are running a little behind here. And I say today, let's go out here to Colorado, because we didn't give Colorado enough attention yesterday in the pandemic update. Let's go to North Parker, Colorado. 35,000 serviced at this wastewater facility. And I'd say pandemic update, I mean wastewater update that we did yesterday. And North Parker, it is rising ever so slightly at this time for COVID on the most recent update, but the overall trajectory is down a little bit. We'll have to see if that holds. Influenza not an issue, RSV not an issue, HMPV is not an issue, Mpox not being detected, and norovirus, it's rising ever so slightly, and there is some being detected at this time. Alright, taking a look at the CDC wastewater site today, and you'll see here on the CDC wastewater site that we do have an increasing number of red and orange sites, which is never good to see. There's 97 orange ones and 11 red ones. Someone did say to me yesterday, or in my comments, saying, these light blue colors are deceiving and it should be yellow. I do agree. That should be a different color because you have 3 different shades of blue. I think there should be another color in between. Perhaps maybe the sites that are really low, maybe they should be green and then you put the blue in between. Would that make any sense? I don't know. Alright, moving on. We do have to take a look at emergency department visits. Yeah, it's not good. We have a lot of states that are stable. We have several that did not update. We have 4 that didn't update. We have 1 that's dropping. The rest of these in the orange and the dark orange, moderate to substantial rises in hospital admissions. We have nothing to report on today in this day in COVID history. We do have to take a look at the dominating variant across the country. That's EG.5. I'm also concerned about the FL 1.5.1, as you know, in the New York region that is starting to rise, which also includes Puerto Rico. I'm not going to get into that argument again, this debate again, but these are the 2 most concerning variants at this time. Let's now take a look at New Jersey. And you'll see today in New Jersey, 221 people in hospital, 4 on a ventilator, in the ICU, 23 discharges. 18 people have been discharged. Let's go across the river to Philadelphia, Pennsylvania. And you see here in Philadelphia, 831 EMS incidents reported on Sunday. That's a very busy day, and that's higher than we would like to see. And looks like their overall incidents, if you include fires, over 1,000 incidents on Sunday. So it was a busy day for the fire department and the rescue services. Let's take a look now at the suburbs. Montgomery County, I'm seeing 3 respiratory incidents, cardiac arrest, cardiac emergency. Overall, not a lot of incidents, but the severity of the incidents are not good. And not terribly busy right now in Chester County. We have respiratory difficulty, sickle pole episode, heart problems, hemorrhaging, and just a fall. Not terribly busy, but a few concerning incidents there right now. Taking a look at New York State. Moving myself back to the right. 551 new cases reported in New York State, but the positivity is now at 12.6%. 7-day average is up to 11.3%. That positivity rate continues to rise, my friends. That's not good. Alrighty, taking a look at hospitalizations in New York State, 657 people in the hospital, 56 people in the ICU. Not terribly concerned about today's number. This just finishes out last week. Tomorrow we start the new week, and we will see. Will it end up higher than where it was at any point last week? My guess is yes, it will. So we're not even going to look at New York City. We will take a look at the admissions here real quickly. And taking a look at New York City admissions, you can see that, yes, overall trajectory, the admissions are going up at this time. Let's go over here to the international update now, shall we? And you can see on the international update around the world, I'm going to refresh this because it may be another country updated. And around the world, cases are down 82%, but don't take that literally. Deaths are down 62%. Don't take that literally either. New Zealand cases are now up 24%. Italy cases down 15%. Australia down 37%. But remember, I was telling you about Ireland. My feeling is there's going to be more hospital outbreaks. They now have a 249% increase in cases in Ireland. 422 versus 121. Belgium's another place that's not doing all that well. Belgium has an 82% increase in cases, 358 versus 197. And going back to Ireland real quickly, because we did not talk about deaths. Deaths are rising there as well. 33% increase, 16 versus 12. Chile, 27% increase in cases. Bolivia cases are down 37%. Afghanistan cases up 24%. Bulgaria cases are up 53%. Switzerland cases up 11%. Iran cases are down 33%. And then we come down here to Norway, where cases are up 13%. Denmark cases are up 18%. Or excuse me, 48%. So there are a lot of places with rising cases right now in Europe. That is relatively concerning. Alrighty, on a final note, I do want to show just my website. I just want to remind you, I do have a website, datareport.info. It's a message board format, but really it's just an archive of information. We have archive of COVID papers and studies. We have COVID positives. We do share news stories there. And I have had a few members sign up, and there's one that does post stuff continuously. He posted something just the other day. I thought this was really interesting. It's about mask harassment incidents, how often. And believe it or not, I chimed in because it's happened to me a few times. I've had people make comments to me why I'm wearing a mask. It's something that should not happen, because you have the people that are for freedoms and liberties. Well, guess what? Hello, if I choose to wear a mask, if you choose to wear a mask, it's your freedom or liberties. So yeah, the website is at COVID Data Report. I'm probably going to be working on the website a little bit later on this evening. Maybe do a little work on the COVID positive archive, because remember, I'm still trying to categorize this. There's just not enough time in a day. I run 2 channels here. I have a job, so whenever I get a chance, I do add some work to this, and I really hope to continue to fill in all the stuff that I missed prior to starting the website. There are lists out there of all the senators, congressmen, political figures that tested positive, and I do want to add that to the website, so hey, we can go back and reference it when a medical emergency happens, because we know these sudden medical emergencies, they're on the increase ever since COVID started. You can deny it, but look at the facts. There were not this many of them prior to COVID. Alrighty, folks, that does it for today's pandemic update. We're going to have another pandemic update again tomorrow. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. And if you know anyone that needs a wake-up call, a reminder that the pandemic is not over, anyone that needs to find out some information about, the effects of COVID, of course you can do that on my website at Data Report. And you can also tell them to share this video and subscribe to my channel down below. Alrighty, I'll see you all again next time. Until I see you again next time, stay safe, everyone. Have a great Monday evening.